Hi, my name is Justin, and I'm a physical therapist here at Core Physical Therapy, where we don't just treat your pain, we get to the core of your problem. Today we're going to talk about low back pain and MRIs. Low back pain is the most common condition that we see here at Core, and it's the most common complaint among physical therapists across the United States. There are a lot of healthcare dollars spent trying to manage this low back pain, and one of the biggest culprits for this is X-rays and MRIs, a lot of excessive imaging. And what we're trying to tell our patients is that the image doesn't tell the whole story. There was a study that was done that took over 3,000 people, none of them had low back pain, and their ages ranged from 20 to 90. And they took MRIs of their low back, and what they found was pretty significant. People in their 30s, 50 to 60% of them already had disc degeneration, and 30 to 40% already had disc bulging. In that same study, the people in their 50s, 70 to 80% of them already had disc degeneration, and 50 to 60% of them had some level of bulging in their low back. Now, what does this mean? Well, again, none of these people had pain, but the MRIs would suggest that they potentially should. The hit-home message here is that structure does not equal function, and just because something looks bad doesn't mean you have to feel bad. Take, for instance, that old beat-up car that you see driving down the road. The owner has put over 300,000 miles in it, and it still runs just as great, if not better, than the day it was purchased. Now, why is that? Well, they took care of it. They took care of the regular maintenance. They changed the oil, the brakes, everything that needs to be done. And if you take care of your body in the same way, you keep things moving, keep things strong, you'll avoid a lot of pain and a lot of complications down the road. And again, the structure does not equal function, the image does not equal feeling. And the pictures don't show tightness, it doesn't show weakness, it doesn't show imbalances left to right and front to back. And that's where us as physical therapists come in, is we find those imbalances, we find those weaknesses, and as we improve your mobility, generally pain follows and that it gets better. And so if you have low back pain, you think you need an MRI, or you've had an MRI and you're worried, give us a call here at Core and help us, or let us help you find what you need to get rid of your pain. You can follow us on Facebook, you can follow us on Twitter at CorePTIA, or check out our website at www.coreptiowa.com.